I'm Shaker Balisa from BSN1A. So today I'm going to demonstrate to you about the bed bath, complete bed bath to the unconscious patient. So bed bath is a science of health and maintenance. So personal hygiene, it is the self-care by which people attend bed to function as bathing, general body hygiene, and grooming. So as a nurse, we are going to do it because some patient can safely leave their bed for bathing. So the purpose of bed bath are, first, to remove microorganism body secretion and dead skin cells. Second is to improve circulation to the skin. Third is to promote relaxation and comfort. Fourth is to prevent body odor. Fifth is to promote sense of well-being. Sixth is to assess the client. Seventh is to provide activity and exercises. So the equipments that I will be using are basin or sink with warm water between 43 to 46 degrees Celsius, soap and soap basin or dish, 3 linens including 1 bath blanket, 2 bath towels, 1 washcloth, clean gown for the patient, bed linen or towel, gloves, personal hygiene articles like deodorant, lotion, and powder that will be used to the patient. Also shaving equipment for the male patients, but we should also always ask for the patient if they are willing to be shaved. Also table for the bathing equipment, and lastly laundry hamper. Procedure is, first I'm going to explain to the client what I am going to do and why it is necessary and how we can cooperate. So in this case, my client is unconscious, so still we need to talk to them as if they are listening to us, because there's a concept, although the client is unconscious, they might hear us. So hi, I'm Nurse Shane, so I'm going to do bed bath, complete bed bath. So I'm going to confirm his name. Okay, Mr. Cañares. So I will do bed bath since the doctor said that we can do it, and it is also necessary to do it since our patient can do it, so it will give them the proper hygiene and it will help them feel better. So I'm going also to wash my hands and provide for my client privacy. I'll close all the door, the windows, and the curtains. So I already washed my hand and closed the curtains, the windows, and the door for his privacy. So next, I'm going to prepare for my client and the environment. Okay, so first, close the windows and the doors to ensure the room is comfortable temperature. So I already done it already. So next, I'm going to offer a client a bed bath or urinal, or ask if the client wants to use the toilet. So he is not conscious, but in case the client is conscious, it is our duty to ask them. Then during the process, do it well and follow the instructions. So during the bath, assess each area of the skin carefully to make sure that every part of the client's body is clean. So prepare the bed and position the client appropriately. So sir, I'm going to position my foot. So easier for us to do it later. Then next, position the bed into a comfortable working height. Okay? It's order for us not to have excess burden working. And I will get my bath blanket and I will put this over the top sheet. I'm going to remove the top sheet from under the bath blanket by starting at the client's shoulder and moving linen down toward the client feet. Okay? And take note, if the bed linen is to be used, place it over the bedside chair. Okay? But if it's going to be changed, place it to the linen or hamper. Okay, sir, I'm going to use this top up. Make sure that the client's body is covered well for his privacy. Starting from the client's shoulder, put it. But if your client is conscious, you can ask him to grab the top part. Since this is to be changed, I'm going to put this on the hamper. After putting the bath blanket, I'm going to remove my client's gown, but make sure that his body is covered with the bath blanket. Mr. Cañares, go to this part. Make sure that this body is still covered. Okay. Then I will place this to the hamper. After removing the gown of the patient, I'm going to first put my gloves. on my both hands. Then, after putting my gloves, I'm going to make a back knit using washcloth. So, this is it. So, after this, I'm going to wash my client's face. Now, I'm going to use or place this towel under my client's head. Okay, sir. Then after that, I'm going to wash my client's eye with water only and dry them after. So I'm going to use this knit, and I'll start with the inner cantos of my client's eye into the other using different side of this. Okay, here, inner to outer, inner to outer. Then after that, if your client is conscious, you can ask him or her whether he or she wants to use soap in her or his face. So I'm going to wash and rinse the client face, neck, and ear. So I'm just going to wipe it again. Face, the ears, the both ears, the neck. Then I'm going to dry it using a towel. Make sure that everything is dry. Then after that, I'm going to remove the towel under my client's head. Now I'm going to wash the arms and hands of my patient. So I'm going to put first towel and place it under my client and under the head. Okay, sir. Nice, thank you. So now I'm going to wash the client's arms. I'm going to elevate it, but I'm going to start with the other hand that is far from me, and I'm going to support it while washing it. Okay? I will just use the wash. Client. We can also dry it with another towel. Then after that, we can put powder or deodorant to the client if desired. Okay, so we will put this. So optional, you can put towel and water basin to the client or near the client so that it is reachable. So after that, I'm going to repeat for the arm and hands nearest me. Okay, I'm going to wash it again, supporting my client's hand and arms. Sure that it is being okay. Then I will use another dry towel to dry or pat dry the arms and hands of my patient. After that, you can use powder deodorant if desired. And I will put powder on my patient. So now I'm going to wash my client's chest and abdomen. So first I'm going to put this bath towel lengthwise over my client's chest. Then I will pull this blanket down on this baby here. After putting the bath towel, I'm just going to use a knit to do a long firm stroke. Make sure that this body is still covered. And after that, I'm doing another towel to dry his body, especially his chest and abdomen area. Make sure that he is well covered. Okay. Then after that, I'm going to replace the bath blanket when the areas have been dried. Okay? I will use this another bath blanket. Going for this one. Place this on the hamper and remove the bath towel under. Then place it on the hamper. Next, I'm going to wash my client's leg and foot. I'm going to expose the leg farther from me, and I'm going to fold the bath blanket toward the other blanket, being careful to keep the perineum covered. So I'm going to lift my client's leg, and I will put this bath towel lengthwise. Okay. Make sure that you're going to expose the other part, okay, and lift the client's leg. Place bath towel like that. Okay. After that, I'm just going to use a mitten to dry client's leg and foot. So I'm going to lift my client's leg, which is away from me. Then I will use this wet meat towel to wash and rinse my client's leg. So I'm going to use a long, smooth, firm stroke. I'm going to start from the ankle to the thigh. Okay, sir. The thigh, lift it. Then make sure that it is. Then after that, I'm going to use a dry towel. Also using long, smooth, firm from ankle to the thigh. Okay, sir. Okay. Then after that, I'm going to reverse the coverings and repeat them in the basin of water. So I'm going to remove the bath towel now and put this on the hamper. Then I'm going to uncover the other part and make sure that I'm going to wash and dry or wash and rinse the other side. I'm going to reverse the covering and repeat them in the basin of the water. So I will uncover this other foot. And I will place the bath towel likewise, the way I did to the other. Okay, sir. Then, I'm going to use wet mitten. I'm going to use a long, smooth, firm stroke from the ankle to the thigh. Lift it. Then rinse it. And after that, I'm going to use a towel to dry. From using a long, smooth, firm stroke from ankle to the thigh. Okay, sir. Then after that, I'm going to dry each foot using this towel. Dry each foot, okay? Remove first, okay? Then uncover the other. Then I will remove the bath towel. Place it into the hamper. Then cover both legs of the patient, especially the foot. Then you can obtain fresh water or bath water when necessary. So now I'm going to wash my client's back and the perineum. So I will assist my client into a prone or side-lying position facing away from me, and I will do it now. Okay, sir? Okay, 1, 2. Okay, make sure that the patient is covered as much as possible. Then I'm going to put this bath towel lengthwise position. Make sure that he is still covered. Then after that, I will wash and dry my client's back. I'm going to use this mitten. I'm going to wash and dry it back. After that, I'm going to use a dry towel to dry the area. I perform a back massage now or after the bath. And now I'm going to remove this bath towel and put this on the hamper or the linen basket. Then I will assist my patient into the supine position and I will let him be on rest. Yes, sir. Hey! Okay, make sure that he's still covered. So next, I'm going to assist the client to supine position already. Client is unconscious, so I can wash his or her perineal area. So I'll be the one to drape and wash the client's perineal area. I will assist my patient using powder deodorant or the lotion if it desired. So after that, I will remove my gloves. Then make sure that the client is comfortable. Then I'm just going to document my findings in the client record. So I'm done doing complete bed, but it doesn't matter 19 years old. So it's okay.